I
Hello.
swear I was prepared earlier.
Hi.
Well, thank you so much for joining today. If you can kind of introduce each other a little bit about yourself, where you're located.
And I am currently in Singapore. I am practicing as an endodontist, which means I'm limited to doing root canals, something that everyone enjoys, right? but
Very much.
yeah, so that's what I'm doing.
I'm Dr. Lorenzo Prieto. I came to Chicago for my prosthodontic residency, which I completed a few years ago. And so I'm practicing prosthodontics in the city, which is basically just kind of boils down to, replacing and restoring teeth, a little bit more complex and involved cases. And I just started practicing in a new practice in Evanston. So it's like the north suburbs here in Chicago.
My name is Adrian Cummins, and I'm a general dentist. I practiced in New York for a year. I was in Philadelphia, actually, clinical faculty at Penn briefly before going into private practice. And then I relocated to Silver Spring, Maryland, doing most aspects of dentistry and then a little bit of facial aesthetics and TMJ, sleep medicine, things like that.
What is TMJ?
So that's the temporomandibular joint, the jaw joint. Most patients don't think about it unless it's bothering them. But most of my practice is limited to clenching, grinding, bad habits that can kind of lead to discomfort. No reason to be stressed right now, but what's there to be stressed about? Here we are.
The first topic we want to discuss is what's changed pre and post COVID, and what are the changes you're seeing at your practice?
From the general side, I guess since we are seeing, recall patients and things like that, what we've noticed are there's two camps. There's very, health-driven patients that were concerned about being overdue that really wanted to come in. And then there was the concern side that was a little bit worried about venturing into a healthcare facility, and the one healthcare facility where you can't really be 6 feet away from someone. We work about 18 inches away from the mouth. So I think the main change between pre and post-COVID was mostly patient education. In dental school, we were all taught to treat every patient as if there was an infection present. So the standards we adhere to, for the most part, are keeping patients safe. And to my knowledge, up to now, there haven't been any cases linked to a dental office. We have done some additional, like extra oral suction units, improved our filter systems, and really tightened up our policies. But I think for the most part, most dentists have probably been at or above the standard of care.
Is there any equipment changes that's happening with the COVID?
The face shield has been a new addition in my office. A lot of hygienists wear face shields before because their procedures can generate some splatter. The mask, there's different views on whether you wear a face shield and a surgical mask, no face shield, N95s. The combinations vary office to office, but I think for the most part, gloves, masks, treat everyone as if there's a communicable disease has kind of been how we operate.
Well, then back a little history, back when HIV became this kind of concern, I think we're kind of seeing something related to that time where we're picking up the face shields and N95s and maybe like you're saying some of the extra oral suction units and changing to medical grade filter systems in rooms. And so I think a lot of these things are going to stay the same moving forward, even when things do get better. And as a patient, I think it's totally, and you're right, and you should just reach out to your dentist and just ask them questions and see what they're doing, and just to see if you'd be comfortable coming in. But I think the dental office is really a safe spot at this point right now.
As far as patient check-ins, we're always triaging patients, such as we have a questionnaire that they can fill out. So we usually ask them their travel history, if they've been hospitalized or if they're showing any symptoms. And also we make sure we take everyone's temperature. And in Singapore, we have this app where everyone has to check in every single building, every single office they go into, and we also record their temperature. So that's something that's been additional in Singapore. And also we mandated that we have intervals between patients so we can minimize the waiting times, also make sure we have enough time for disinfection. And also, even in the waiting rooms, we have chairs set up that are like 1 meter apart from each other so that, there's minimal contact and there's at least like some social distancing between patients. And of course, limiting the amount of patients that are waiting in the office as well.
Do we do the same thing in the US?
Yeah. In my office, we take it. I think a lot of offices have adopted it. I'm not sure if it's mandated, but I do know a lot of offices have implemented it themselves.
Yep. Yeah, we're taking temperatures here as well. All patients and staff, everyone.
Do you see any changes in number of reservation? Do you feel as busy as before, or little less or more?
We had like something called a circuit breaker. So during that time, even as far as dentistry, the government made sure it's like it has to be essential procedures. So we were very limited to certain procedures. So because of that, we had to delay a lot of patients. And after the reopening now, it's just been super busy because all the patients that have been delayed, we have to see those patients. So I've actually seen a huge increase in numbers. And I think it's like we're trying our best to open in phases, but like if you're in pain, and if you have a cracked tooth, you can't wait for a long time. So I've definitely seen a lot more patients in the past 2-3 months.
We're closed from March 15th through June 15th, basically. And, in that time, if it was an emergency that really couldn't wait, then, we'd make special arrangements to come in to see the patient. But we really did have a 3-month backlog, which, I didn't pick the greatest time to open a new office, but I think that where we might have lost some momentum with newer patients, we definitely saw an uptick in emergencies. And then, you manage an emergency the right way, that becomes a new patient. So things are kind of breaking even for us, fortunately.
Yeah, you're right. Yeah, we're not getting a lot of new patients per se, but the ones that you do see for emergencies and you take good care of them, they're becoming, part of your patients at the practice.
Have you noticed any interesting changes in your practice during COVID? I think a lot of people are staying home and constant snacking. A lot of people pick up on drinking. Sometimes we skip morning to, brushing your teeth. Do you see any changes in patients that you've been seeing regularly, if their teeth has been worse or better?
I've seen two types really. So some people, because they're at home, are paying a lot closer attention. So I've had patients come in for recalls that are, 5 months overdue, that are spotless just because of how, attentive they've been to their brushing, their flossing and everything else. And of course you see a little bit more of the, clenching, grinding, chipped teeth, things like that. So signs of stress have gone up, but I do think that there are a lot of patients also that are taking really good care of their teeth in the downtime.
Definitely seen a lot more cracked teeth with anxiety, stress. So what we really promote at OJOOK is also setting your daily intentions. And I think that's really important during these times when people have a lot of stress to manage. So just taking it day by day, really kind of tackling by setting those intentions, I think that really helps.
Especially too, since a lot of people's routines kind of got thrown out of whack when they don't have to maybe go into work or do whatever their typical thing, go to school or something like that. So it's kind of setting a plan for each day to try to whether it's goals you're trying to get or just do things to hobbies, things like that, to keep your interests and stuff like that. I think that's pretty important.
Yeah, I think whatever you have been doing, COVID amplified it. So if you were being good, I think that as a result of COVID, you've been extra attentive. But if you're either a high-risk patient, maybe you needed checkups every 3 or 4 months instead of every 6 months, or maybe there was active disease at one point that has been taken care of, but no, we want to maintain it. I do notice that there's been some deterioration in some of those cases, like higher risk cases.
As Dr. Kim mentioned, at OJOOK, we really highlight your routines transforming into daily ritual. I'd love to hear from this panel, what's your morning ritual, your oral hygiene, also some other things you do to set your day right?
First, not just because I'm a dentist, but the first thing I do is brush my teeth. I think that's a good time, whether you're in a rush or not, to really mentally run through your to-do list. So to me, that's my first rehearsal for the day, where as I'm brushing my teeth, I'm really thinking about what I'm going to do next. And then secondly, for me, I make my bed, just again, a little bit of OCD, but I just like checking things off from the moment that I wake up. And then it's usually a short, 20 to 30 minute workout, then shower and head into the office. From the biggest change from being an associate to a practice owner is before the office opens, that's the only time of the day where it's really your time. As soon as the doors open, you're managing multiple personalities, staffing, everything else. So I really do try to maximize the time where I can focus on what I need to get done. So those first, couple hours are really important to me.
For me, getting up, shower. I'm a morning showering person. Brushing my teeth, flossing, mouth rinse. The one I think kind of the similar to Dr. Cummins, I like to iron my clothes like really well, and even though I could do it probably the night before and have that ready to go, I still like doing that in the morning, and it gives me some sort of therapeutic, relaxation. And then I'm very lucky with my drive up to Evanston that I get to go by the lake all the way up. And so I get to kind of see the sunrise over the lake, and I play very relaxing lo-fi, like chill music in my car drive up there, and that kind of gets me centered and in a good state of mind, and kind of can think about some things before you get to the practice, and kind of have to take in all that. So.
Oh, you're a role model for us. You should play our playlist. We have morning and evening ritual. I'll send you the link.
Yeah.
How about you, Dr.
We'll
Kim?
have to get like a recording of Dr. Prieto driving.
Oh, maybe you can suggest the playlist like DJ.
And
Hey,
he's also
I'd love to share. Yeah, I do make some music too on the side.
Oh, really?
See, perfect.
Any talent? How about you, Dr. Kim?
I guess it's not that different, but I usually try to work out in the morning. So when I'm really tired, I think brushing my teeth really helps. So like Dr. Adrian said, as soon as I wake up, I brush my teeth, do some stretches, and then, shower and then head to the office. I usually take public transportation. I'm not driving here. So I just like staring outside and, like just looking at all the people that are up early, heading their way. And it's, you see a lot of like older people, going to buy groceries and stuff like that. And you just kind of appreciate there's like a lot of nature around here. It's a lot of green in Singapore. So you just appreciate like each day. And I think that's like a time where I can just kind of sit quietly, just like stare outside and enjoy, the start of the day.
Great. Okay, I think that's covering the topic one.